Hi, I'm Dr. Matt Rasmussen with Periodontics and Implant Dentistry of Tallahassee. We've been getting more questions about sedation dentistry, so I want to spend some time today going through some of the most common questions that we get regarding sedation dentistry. Sedation is used for a couple different reasons in dentistry. Many patients are very fearful of the dentist or have had poor experiences in the past. So sedation dentistry is an option where the patient may not remember the prior treatment or is not going to be fully aware of the treatment as it's going on. Also, many patients have very significant needs, so the appointments may be longer. Sedation dentistry is very helpful with patients who may be in the chair for more than an hour or two. There are a number of types of sedation options that are available in dentistry. So we'll go through the main ones that we use in our office, but I'll hit some of the ones that are in more controlled settings as well. When people think of sedation, sometimes they think of like they're going into the hospital and it's under general anesthesia. That's not very common within dentistry. The most significant type of sedation is typically with oral surgeons for things like wisdom teeth. That's something known as IV sedation. In our office, we offer two different types of sedation that are slightly lighter than that deeper type of sedation. We offer nitrous oxide, which is a gas that allows someone to feel often described as a little bit floaty or a little bit loose at the time of the appointment, but is not a deep type of sedation. We also offer oral sedation, where a patient takes a pill the night before, one the morning of, and takes a few pills afterwards. Patient typically will have a driver with them because they may or may not remember much of the appointment after the time of the procedure, and typically patients are going to be more sedated with oral sedation. Many patients are good candidates for sedation dentistry. Well, you'll want to talk with your doctor at the time of the exam to see if there's any medical contraindications that would make you not a candidate for sedation. But the majority of people that come to our practice are good candidates for sedation dentistry if it's something they would like to pursue. A common question we get is, what is the difference between general anesthesia and sedation dentistry? When someone is being sedated in a typical dental office, they are technically awake at the time of the procedure. So if we ask them to turn their head to the left, turn their head to the right, or we ask them a question, they typically will be able to answer. Now, sometimes the patient will fall asleep during the procedure. That's not always the case. This is different than something like general anesthesia, where a patient is under such a level of sedation they have to have an airway and all sorts of things put in place, which is a much more involved medical procedure. Nitrous oxide is a gas that can be used at the time of a procedure that allows the patient to feel slightly euphoric or have a good feeling during the time of the procedure. It's an excellent option for lots of patients that don't want to be fully sedated, but may want something to help them relax a little bit more during the time of their dental appointments. It's a very common thing to use because it's very safe and very easy to use, and it's relatively low cost. Oral sedation is a type of sedation where pills are taken by mouth. The pills are made to have the patient slightly relax, and oftentimes the patient may not remember the procedure afterwards. In our office, we typically use a medication called Halcyon, otherwise known as Triazolam. Patients typically will take one pill the night before the procedure. They'll come into the office, they'll take one pill 1 hour prior to the procedure time, and then we'll titrate to effect with one or two additional pills in the office. Most patients when on this medication will typically not remember the appointment after the day of the appointment. There are a number of benefits for sedation dentistry for those patients who are anxious or fearful of the dentist. For most people, they will be less aware of the procedure at the time when they're sedated. Therefore, they can sit in the chair more comfortably. Another strong benefit of sedation dentistry is that there's something known as anterograde amnesia, meaning after they start taking the medication, they're not going to remember most of the procedure afterwards. So even if they are technically awake, they will not have a bad experience after the fact because they'll just have the procedure done and they kind of move on with their lives. Sedation dentistry is something that is very safe for the vast majority of patients. There are certain medical conditions that would contraindicate or make it not a good option for particular patients. It's important that you have a discussion with your doctor at the time of the exam to see if any medical contraindications would be present that would make it where you're not a good candidate for sedation dentistry. With a dental procedure with sedation, there are a number of things that you would look to expect ahead of time. First, remember that before the procedure, we're going to have full consent forms and you'll have a driver with you, and that you will not have anything to eat or drink other than clear liquids for 6 hours prior to the appointment. For this reason, if someone is sedated, we typically try to do those appointments relatively early in the morning. For the day of the procedure, the main things to expect would be that you'll come into the office early for the appointment. We'll give that medication. We'll titrate to effect. Prior to the procedure, you may feel a little bit drowsy or loopy, as some people would say, and then the procedure will go as planned, and then you would head on home afterwards. Many patients will not necessarily remember the procedure after the fact, and that's okay. Remember, we've got a driver with you to answer any questions or do any additional forms or anything like that while you're in the chair. Nitrous oxide, with a common name known as laughing gas, is a gas that's administered through a nasal cannula at the time of a dental procedure. Most patients report they feel a slight loopy or happy feeling in the chair. Now, some patients do laugh. It's not all that common that patients laugh in the chair, but most patients just feel slightly more relaxed than they would otherwise, and it makes dental appointments go easier for those patients who are slightly anxious in the dental office. The medications that are used in oral sedation take some time to wear off. For this reason, after your appointment in the office, we'll oftentimes have the patient stay in the office while on monitors for a period of time to make sure that they're beginning to recover from the sedative effects. However, there is some medicine still in the system after that appointment. For this reason, we recommend not taking any other medications that have a sedative effect for 24 hours. This can include strong pain medications like Percocet or other sleeping aids, as again, there may be slight amounts of the sedation medication still in the system. Many patients have concerns regarding the experience in the chair with more involved procedures. If it's something that you think would be helpful, please feel free to ask questions at the time of the exam to discuss options regarding oral sedation or nitrous oxide. A common question that comes up in our office is what types of procedures can be performed while a patient is being sedated. Now, there are multiple types of sedation. Two options that we typically use in the office are oral sedation, which is more involved, and nitrous oxide, which is less involved and more straightforward. Typically, for more involved procedures like dental implants, if a patient wants something like oral sedation, they're more than welcome to have it. For something that's less involved, such as a dental cleaning, we'll typically urge the patient to consider something like laughing gas, as there's less time involved, there's less cost involved, it's a more straightforward process. Since we can make most patients comfortable for regular dental cleanings in the chair, either just with regular numbing or possibly laughing gas, we typically do not do oral sedation for cleaning visits. A common question that comes up is what precautions or things do they need to take into consideration prior to a sedation visit at the dental office? In our office, we have a pre-operative appointment where we're going to go through in writing and verbally over all the instructions of what to expect before, during, and after the appointment. So again, at that point, we'll go through all the specifics on what clothes to wear, what to eat or drink prior to the procedure, who needs to be with you, and things along those lines. Some patients have concerns regarding the safety of sedation dentistry. Now, the first point to keep in mind is that sedation dentistry is at the request of the patient if they feel that anxiety or fear is going to be a concern at the appointment. There are no procedures that we do in the office where sedation is fully required. If a patient's concerned about any kind of safety issues with sedation, I would strongly urge them to talk with their physician as well as their dental professional to make sure about any medical contraindications that may indicate that sedation dentistry may not be needed. I would also urge those patients, if they feel like they can proceed without sedation, to consider something less invasive. So possibly only nitrous oxide as opposed to oral sedation, or consider going through the procedures without sedation. I hope I've been able to answer some of your questions regarding oral sedation. If you have any additional or more specific questions regarding oral sedation, please give us a call at area code 850-692-9200. We'd love to see you at an exam and discuss it further.